I'm a dental hygienist, and I think I killed my last patient. I'm trying to type this before the police come back. I'm sorry for the grammar or the spelling. I just need to get everything down. I don't know what they think or what happened if they think I did it, but I need to get this all out before anything bad happens. Well, before anything worse happens, I start with what I know is true. My name is Lindsay Cooling. I work as a dental hygienist in Boston at Dr. Peter's Careful office near Front Street. I have worked there for approximately 11 months and 23 days. What I don't know is if today I killed a patient or if that was even a human. That's crazy, like some sort of otherworldly demon monster will show up after a 6-month check-up. But I swear what happened today has no explanation besides something supernatural. I've seen a lot of shit. People who don't brush their teeth or don't floss. People who sores surrounding their entire mouth. Tonsil stones with the size of walnuts. I get mouths are weird and can be gross, but I'm not some fighty kid. I come in on time, do my job, and treat all of my patients with respect. Here's what I remember. The last patient of the day was at 4:45. Our office closed at 6, and I remember I'm hoping that I would get out earlier. But that's exactly not what happened. They just said they needed a quick checkup so that maybe I could scout out a few minutes early and beat the rest of my commuter crowd to the T station. I walked out our receptionist, Tara, and she handed me the patient's file. I remember thinking it looked pretty sparse. Even new patients usually have an old record that were sent over, or at least in any emergency context she filled out. The only thing this file was named was just having a name and the symptoms and complaint sheet. There wasn't even a date of birth. I remember looking at Sarah, but she shrugged and went back to texting. She's a nice girl, but a terrible receptionist. I walked into the room waiting, and there was only a young woman sitting in the corner. The first real thing about her was she was sitting up straight, staring directly at the door, leading back into their practice. Most people have their phones out or maybe a book, if they were older, but she was just sitting there, hands folded, looking as if she was waiting for me. I mean, I guess she was, but it was just a bit odd. I walked over and introduced myself, explained that I would be cleaning her teeth today, and she just stared at me. She didn't even blink. She just stared. For a second, I thought maybe she didn't speak English. We have plenty of patients who aren't native speakers, but we usually have a translator sign on. I decided to ask her about one of the complaints on her sheet. General discomfort. I asked if she experienced a wow, or brushing or eating. Was there any sensitive to hot or cold? And she nodded or shook her head at appropriate times. So I figured she was a little odd, but at least I would have to try and make small talk while my hands were in her mouth. I got her seated and opened a new patient file. On the computer, I asked her some basic questions. I had her name, Jane, but everything else was blank. I tried asking her for her phone number to call her on the email. She shook her head indicating she didn't have either. I asked maybe she had a boyfriend or girlfriend, someone who I can get in touch with, and she just shook her head. I asked if she had a mailing address, since we didn't have a few older patients with phones or emails who needed all their information sent through the mail, but again she shook her head. I was running through all the possible scenarios in my mind, but she was homeless. Maybe she was a runaway, maybe she was trying to not be found by some abusive asshole. I just remember thinking that it was just nothing. I had a job and that was that. Why that was stupid, and I get that. I know better. I was trying to be a good person. I figured fuck it. I want to touch up her teeth and get her out of there as quickly as possible. Then just tell Dr. S that she had been a no call, no show, and that we didn't have any information to send an invoice for the missed appointment. It had happened before. It wasn't a huge deal. You have to understand, I was trying to do the right thing. I wasn't until I had her reclined in her seat. I realized the extent of the damage. Honestly, I don't know how I hadn't noticed earlier, but lighting on her lips, the reception area, helped conceal it. Her lips looked awful. They were puffy, almost bruised, looking like with strips of flesh so dry they looked almost black. I had seen people come in with botched lip fillers, but this was something else. The skin on the side of her mouth was raw and ragged. Twin slices parted at the edges as she tried to hide her widened smile with a switchblade. Something wriggled under the thin layer of the skin. near her Cupid's bow. I remember thinking I had no idea what this woman has been through, and I was just here to clean her teeth, not to judge. I just put on a clean pair of gloves and applied some petroleum jelly to prevent her lips from cracking and bleeding. I didn't say anything about it. I didn't want to embarrass her. Remember, I was trying to be nice. She opened her mouth slightly and foul odor hit me. It smelled like sulfur and pennies mixed with rotting flowers. I honestly thought I might gag, but I said nothing and began to move my tools around inside of her mouth. Her gums were receding at an alarming rate. The root of each tooth was plainly visible, and ones of her candies seemed to have rotten from the inside. Her molars were black and looked like as if her wisdom teeth had begun to rest, her gums pushing the remaining teeth together into a massive cluster. This was too much. There was too much damage for one person to handle in a single visit. She needed extensive work, maybe even surgery. I asked her how long has it been since she's been to a dentist. She shrugged. I gently began to try to remove the tartar buildup, but as the pick hit her molar, it sank into the tooth. It sank. I know that sounds crazy, but I saw the tip of my tool just sank into her tooth as the molar collapsed in itself. I know some people have soft teeth, but that just means they're more prone to this. I had no idea what I was doing. I was trying to chip off or break them off. It doesn't mean they are in a bit same consistency as wet sand down. I felt a bill rise in my throat, then I clamped down hard on the inside of my cheek and kept working. I tried the other tooth and was met with the same level of resistance. This is to say almost none. How was this woman eating? How was she even drinking? There was a hit of something moving inside her gums, like an inchworm slowly exploring the space. It freaked me out so much I pulled my tools out too quickly. I hit her front teeth. I began to apologize, blame it on the trick of light, but the teeth that had made contact with my tools were suddenly bleeding from the guns. Not unusual. Honestly, seeing that almost made me feel better. It brought me back to reality. It brought me back for approximately 30 seconds. As soon as I registered that the gums were bleeding from her tooth popped out of her mouth, at first it was just one, and it came out so fast. It was like when a child that hangs on to a baby tooth for too long and a strong wind will take it out. It broke free so easily. Before I could say anything, the space where the tooth and previously began to bleed profusely, a steady stream of blood was pouring out of her mouth. The worst part, I don't think she even noticed. She sat in the chair, eyes staring to the ceiling as if this was a normal day. I quickly grabbed the gaze and began to apply pressure, stopping the bleeding from once my fingers grazed another tooth. They fell into her mouth and onto the floor. More and more teeth slipped from her mouth, tumbling down the front of her blouse as more and more blood poured out in the back of her throat. I called for Dr. S, but he didn't respond. I called for Becky, another hygienist, but still got no answer. In a last-ditch attempt to help this poor woman, I called for Tara, but even she did not respond. I watched as the woman's mouth filled with dark red blood. I reached for my ejector, but the blood was coming out too fast for the little straw to suck up. The liquid started to dribble down her chin, spattering across the tile floor. I screamed for anyone to help, but there was no answer. The blood soaked into my white sneakers, the rubber soles slipping, unable to find purchase. The whole time, the woman just staring blankly into the ceiling, even as if she choked and gagged on her own blood and saliva. Her eyes never showed an ounce of fear. I kept ramming the gaze into her empty sockets, but they seemed to make no difference. There was too much blood on the floor. There was no way she was going to bleed out if she hadn't already. Slipping across the tile floor, I ran for the door, my hands sticky with the gore. The door wouldn't even open. I pulled and pulled, and God, I wasn't sure I could exit anymore. But the door opened. As the blood began to cover my sneakers and squish over my ankles, I gagged as the smell of copper flooded my nostrils. As the room began to fill, I began to scream, to have the sound drowned out by the sickening sound of the woman laughing as she gargled what must have been gallons of blood. She was hysterical. Her whole body was cultivating as she let out this god-awful laugh in between huge gulping breaths. They were only obstructed by the blood that refused to stop pouring from her mouth. I screamed one last time as the flood overtook me. I could feel the hot liquid as it crashed over my face, sputtering as the blood filled my mouth and ears, blinking as it pushed its way into my eyes. I remember this moment of clarity, just thinking this was how I was gonna die. I would drown in this thing's blood. The next thing I knew, Dr. S was holding my hand in his hands and his eyes were swimming with worry. I could see him mouthing words. I think he was saying my name. Tara was standing behind him with her phone, her hand speaking fast into the receiver. The rest of what happened was a blur. I think they sedated me. My throat was still raw from screaming. They told me that the homeless woman who wandered into her office had died while I cleaned her teeth. I think it was some sort of break from reality due to the trauma of having the patient die. But even with that said, that couldn't explain all the blood on my clothes. I can still taste the blood between my teeth. The police are coming back to my room now. I can hear the radios crackling. I need someone to tell me what happened. Just please, does someone know what really happened?